Namaste, I am Dr. Shamla Gopi, consultant urologist with special interest in urinary incontinence, female urology and urodynamics. Today I will talk to you on urinary incontinence. This week, June 20th to 26th, is celebrated as World Continence Week. It is an initiative by the International Continence Society. I would like to take this opportunity during this week to raise awareness on urinary incontinence. So, what is urinary incontinence? It is the loss of control of urine or leakage of urine. Now, you need to know there are several types of urinary incontinence. First is urge incontinence, where you have the sudden compelling feeling to pass urine, and by the time you reach the toilet, you leak. The second type of incontinence is the leak, which is commonly mentioned by most women, that is leak on coughing, sneezing, lifting heavy weights or bending. There is another type of leak which is a combination of both urge leak and stress urinary leak. When patients hold a large amount of urine, more than a liter or two, and they overflow, and that is called overflow leak. The fourth type of leak can be due to neurogenic bladder. Now, neurogenic bladder is a term where the nerve supplying the bladder from the brain to the spinal cord and to the bladder is affected, and this can follow stroke or cerebrovascular accident, Parkinson's or multiple sclerosis, to name a few. So, urinary incontinence, whom does it affect, when does it affect, and what age does it affect? Urinary leak affects both men, women. It also affects the children and adolescents. Now, men, it is common because of prostatic obstruction, and in women it can be due to any of the reasons that I have mentioned to you before. So, what are the causes of urinary leak? If it is of short duration, the commonest is urinary tract infection. The other causes which are long standing can be due to a bladder outflow obstruction. In women, due to various causes like recurrent vaginitis or postmenopausal, the urine opening appears shrunk or it gets narrowed, and this is called distal urethral stenosis. It can be due to a condition called overactive bladder, where the pressure within the bladder goes very high and patients leak without their knowledge or without their control. The stress urinary incontinence is because of the weakness of the urine passage muscle, and that happens when you cough, when you sneeze, when you bend, when you jog, and this can be quite troublesome, quite embarrassing, because you are restricted to social activities, you are restricted in going out, and you prefer to be housebound. So, how do we diagnose? What do you do? The most important thing is you approach a specialist, a urologist, and he or she needs to evaluate the reason behind the urinary leak. So, there are basic tests, but before that you need a detailed history that your urologist will get from you, and a complete examination, a general examination, a neurological examination and local examination. In women, it is important to ensure that there is no prolapse of the uterus causing these problems, and in men an enlarged prostate can cause this. And once we finish with the history, there are some basic tests that we need to perform. Urine test to rule out infection, blood test to ensure that the kidney function is normal, ultrasound or scan of your kidneys and bladder is very important to ensure that your bladder emptying is good and your kidneys are of normal size. And the most specialized test to identify the cause of urinary leak is called urodynamics. So, what is urodynamics? Urodynamics is a physiological functional assessment test of your bladder and your urine passage. It is a simple test, though it is specialized. It takes about 10 minutes, where I fill the bladder with water and see the pressure on the monitor, and this gives me information about whether the bladder is overactive, whether it's underactive, or whether the leak is because of weakness of the urine tube muscle. Cystoscopy or endoscopy of the bladder is another test to complete the evaluation, because if you are having recurrent urinary tract infection, it is important to know how the bladder lining is. If the bladder is overactive or underactive, it gives us a lot of information on the bladder lining. And it also ensures that there is no abnormal pathology like a small tumor that we may miss on an ultrasound. If there is a neurological problem, it is important we also involve the neurologist and do an MRI of the lumbosacral spine to ensure that there is no nerve compression to the bladder. Having got a complete history and done some basic tests and specialized tests like urodynamics, you might wonder, is treatment available for urinary leak? Yes, treatment is available and the tests are simple. It does not require any general anesthesia. A complete evaluation gives us information on the type of bladder so that the appropriate treatment is instituted. For people or patients with overactive bladder or neurogenic bladder, they can be treated with medicines. If the bladder emptying is not good and patients are holding large amounts of urine, you may need assisted bladder drainage and we will advise you accordingly. So when is surgery offered for patients with urinary leak? When patients have genuine stress incontinence after a period of good pelvic floor exercise, then sling operation can be offered to them. Patients with significant prolapse of the uterus with no other abnormality in the uterus, pelvic floor repair can be offered to them. Surgery is also offered for men with prostatic obstruction causing significant urinary problems. So what is the goal to cure urinary incontinence? Why do we need to treat urinary incontinence? Now, urinary leak can also present with recurrent urinary tract infection and sepsis. It can also predispose to kidney failure. So these are the two major factors where we have to concentrate and patients have to give importance to come and get their urinary leak evaluated and treated. Apart from this, urinary leak can be very bothersome. It can affect your day-to-day activities. It is a social embarrassment and it reduces your self-esteem and therefore your quality of life. Take-home message for all of you today is urinary leak is a common condition. Please do not suffer in silence. Get help. Go to a urology specialist for a complete evaluation and treatment. Thank you for having taken your time to listen to this topic. It's important that you raise this awareness among your family and friends. Urinary incontinence is a treatable condition. Thank you for coming.